Good morning, it's Misty here. I know I'm wearing the same thing as I finished off yesterday because it's the next morning. Today is, the date is June 18th, 2026. It is cycle 2, day 2. So I had my infusion yesterday. Oh, I have a headache today. It's pretty good headache. So last night, well, I'll start earlier. I was pretty tired when I got home, but I had a few things I wanted to get done and I wanted to do the recording. So I got that done and I watched it. And just as I was finishing up watching it, it was a bit lengthy. Troy got home and he brought home a bunch of groceries and he was tired. It was a tough day for him too. And the grocery store was hectic and he just put the grocery bags on the counter and sat down for a bit. He needed some downtime too. So we sat and chatted for a bit and I thought, well, I can get up and put the milk in the fridge. And I don't know, I guess I think it's the steroids that I'm on. But I managed to get all the groceries put away and did something that I'm not super great at to begin with. I washed all the produce before it went in the fridge. Often I end up, just because I get tired, I put the produce in the fridge and then have to wash it before each use. But I got that all done, which is great. And part of the reason why I pushed to do that is because I just don't know my energy level for the next number of days. And if I can simplify things, it's good preparation. So got all that done, and we had a crock pot dinner last night, which was excellent because it was just minimal effort to get it on the table. And it turned out really good. Troy likes lots of seasoning in his food, and he really liked it. And I found it was just a bit too much for me, but as always in our stew, the carrots were still really yummy, and that is my favorite part. It was good. It just was lots of seasoning in it. So I went and sat down, and I was tired, but I guess I really just didn't feel like sleeping, so I puttered around on my phone and did some organizing on it and stuff, and did my blood pressure. It was okay. Took my temperature. It was fine. Decided I should go to bed. Even if I don't feel tired, I wanted to go to bed at a decent time, because if I got a second wind, I could be up half the night. So I went to bed I headed there before 10. And one video I come across recently talked about, what the heck is it called? Neutro Auto. I think that's what it's called. I hope I'm not mixed up. It is one of the things that they look for in the pre-treatment lab work to make sure that the white blood cells, it's part of the white blood cells, can help fight off infection. And if that's not high enough, they will postpone the next chemo infusion. That video got into detail about different types of infections and said that virus infections aren't as hard on a chemo patient. So before I go on, I'll give a disclaimer. I did not fact check this. This is just what I got off this video, and it was just information for me to take and try and learn from. And I will be asking about it and looking it up more, but the virus, bacteria the white blood cell system can often be effective enough to get you through a virus infection, cold, something like that. A bacterial infection, with having the neutral auto below a certain number or even just low, it is harder for the body to combat a bacterial infection. And that often comes from within your own body. One place that has a lot of bacteria is in your mouth. Good bacteria and bad bacteria. So it talked about flossing. And in this video, it said if you don't normally floss, talk to your medical team about starting before you do, because if you have a whole bunch of bacteria in your mouth and you floss and get it floating around in your body, it might not be a good thing. If you are a flosser, keep it up, don't stop because of that. And listening to the way she talked about it, I thought about how I floss, and I floss quite regularly, daily, if not a few times a day. And I use those picks, and they're handy, and I'll just use them wherever, especially if I feel like I have something stuck between my teeth. That irritates me, so I like to get it taken care of sooner than later. But if I'm away from the bathroom and I floss, then whatever sticks to the pick gets thrown in the garbage, but whatever just gets dislodged in my mouth gets swallowed. So I'm kind of thinking that it's a wise decision in my situation to go to the bathroom and rinse my mouth each time I do these flossing, so that when I dislodge any of the bacteria, it gets washed away instead of swallowed. So they never said to do that, but to me that just seems logical. And for the most part, I'm not going to say that I have to be 100% on it. If I'm uptown and I eat something and it gets stuck in my tooth and between my teeth and I need to get it out, I'm probably just going to get it out and go back to making sure I rinse when I'm at home. But I thought that would be a relatively easy practice to incorporate into my routines. The other thing they talked about is toothbrushing. They should, to help with the bacteria, or removal of it, I suppose, doubling the amount of time that you do your oral hygiene. So if you typically brush your teeth once a day, it would be good practice to brush your teeth twice a day. If you typically brush your teeth twice a day, it would be good practice to try and brush your teeth 4 times a day. So learning more about the bacteria and stuff like that, it, to me, even though it's a little bit of a pain in the butt, well, not in the butt, but it's time consuming and kind of another little chore, I'm going to keep that in mind and do what I can with that. But I typically have really good oral hygiene. Unfortunately, I had my next dental cleaning between my surgery and when chemo started, and the dentist wouldn't do a cleaning on my teeth without the doctor's clearance on it because of the bacteria. And I was not familiar with that at the time when I went to the dentist, so to me it seemed a bit over precautious. But now that I'm learning a little more about it, I can understand their stance on it. And I did get my family doctor to sign off on it. But I never made it into the dental clinic to have my, what the heck is it called? Between the headache and what they call chemo brain, sometimes the words are just hard to find. I guess my maintenance cleaning, I wasn't able to get it done, so that does make me think that I definitely could, or maybe should, bump up just 3 or 4 times a day for brushing. But anyways, I will, and definitely doing a proper spit out and rinse. When it comes to mouthwashes, they say like an alcohol-based mouthwash, whether it be Listerine or whatever brand, can be very drying in the mouth, and it can contribute to or aggravate mouth sores that can be common with these chemo treatments. But just another thing that I heard. This is not fact-checked, and I just have to say that because what I'm learning may or may not be right. It's just stuff that kind of stood out for me. This morning I got up and took my blood pressure, and I've kind of jumped ahead because I wanted to take a drink of my smoothie. The coldness of my smoothie when I have a drink of it kind of distracts me for a millisecond on my headache. That's good. I better have another sip because it's starting to warm up. They're really not pretty, but I like them anyway. Or, I don't mind the green colored smoothies. I think I like every color out there, but Troy thinks that it isn't very appetizing. He likes it when I make pink smoothies that have the color from the strawberries. But when I get adding some of these other green things in there, whether it be spinach or a green powder mix or whatever, it overpowers the pink and kind of makes it an ugly green brown sometimes. So anyways, went to bed last night and went to sleep relatively quickly. I was Googling and watching some YouTube videos, learning about, more so about anemia and red blood cells and white blood cells and platelets and all that. It just really, to me, if I can learn a little bit about it when I go in and talk to my medical team, I can understand what they're talking about a little bit. I, by no stretch, think that I have more than 1% or 0.1% knowledge in the medical field. I have no training in it whatsoever. I did a psychology course, and that's not any totally different medical thing. But learning about this stuff, I do find helps me bring quality questions to my medical team and helps me understand a little bit of what they're talking about. And if I don't, then I can ask, and I don't know, if I can get some of the information outside of those appointments, it saves time for me and them in these appointments to address the stuff that I can't find on my own. Anyways, I went to sleep. Yeah, that anyways probably isn't my best word, but it seems to be a common word I use. Was watching the videos and went to sleep. I had to switch to a video that wasn't as interesting so my brain could shut itself off and go to sleep. Went to sleep, slept really good till about 3:30 this morning. And where we're located, we don't get much darkness. And it was like super bright out at 3:30 this morning, like daylight brightness. Not sunny, but daylight brightness. So I laid there for a bit, and then I thought, well, I might as well go to the bathroom and get a drink and do all that. And then if I happen to go back to sleep, nature won't be calling quite as soon. But I never did fall back to sleep. I don't know. I think it's the steroid that I'm on with this chemo treatment. I'm on it for a few days, but my body is tired and I want to go to sleep, but I just can't fall asleep. So I'm pretty tired right now. I got up this morning, did my blood pressure and temperature. Yeah, that was a repeat. I know I already said that. Then I made a smoothie. I'm really, especially on these first days after the treatment, focus on my protein and my produce intake and water. Made my smoothie, and then I got my potatoes all chopped up and into the cast iron frying pan. My iron is low. It's something that I got my labs back last night about, and when I Google it, it is a concern. So I hope today or soon I'll be talking to the medical team to see what can be done about it. The oral iron that I'm taking, according to Google, says that with the type of chemo I'm on, it's not easily absorbed through the digestive system. So if it is taken intravenously, it can potentially be absorbed more readily and get my numbers up. So that's one option is an iron infusion. And the other option that I was reading about is a red blood cell transfusion. So I'll talk to them and see what they have to say. There was a few other things that might be fitting to the low iron. My breathing has been worse than before, and I just was kind of chalking it up to being sedentary, but I think it's something that the medical team and I need to discuss a little further. It was bothersome enough that I did talk to my GP about getting a Ventolin inhaler, and I've used it a few times. I tried to use it multiple times a day as preventative, 2 to 3 times, and I tried using it pre-exercise, and I actually didn't notice a difference, so I don't think that that's what's going on. So maybe it's my iron levels. It does say that if your iron is low, that the oxygen has a hard time getting to the rest of your body and into your lungs, so that very well could be or out of your lungs, I suppose, from your lungs to the rest. It could be part of the fatigue that I'm having. Right now I'm just working on my smoothie and doing this video. Have my potatoes frying in the cast iron frying pan, and I'm gonna attempt another nap. Yeah, I don't know, these videos seem to get long. I get lots to talk about, it seems like. I don't know, I don't know if you guys find it interesting. I do. Yeah, so I'm going to sign off for a bit, and I'll check back in later on. See you guys. Thanks so much for checking on me. I know it probably doesn't look like I've done anything, but because I'm in the exact same spot with the exact same everything. But I did. I went and made my breakfast. I just put pictures there of it cooking, and that good full dish for breakfast. We'll see if I can manage to eat all of it. If not, I'll work on it again later. But I think it's a high value nutritional meal that my body really needs right now. Darn, there was something else I was going to say, but I can't remember. But I am played right out from doing that. So my plan is to eat my breakfast and drink some water and actually have a nap. Yeah, that's how I feel. So I really hope a nap happens. All right, talk to you again soon. This will be me pretty much all day, just hanging out here and only getting up to do the necessary things to get a drink and eat and go to the bathroom. I don't feel bad, but I am extremely tired. This morning before Troy left, I asked him what his thoughts were with me nicely hounding the clinic to make sure to follow up on the blood work that I had done yesterday for my iron. And we hummed and hawed whether I should nag them. And I kind of had it in my mind that I would revisit the idea at noon and maybe call them after, around then or after lunch, shortly after lunch, to kind of give a bit of a reminder that it's important. Well, I think it was about 9:30, my nurse from yesterday called, which I think that's absolutely fantastic. She went over my lab results, and she said that my iron is sitting at 5. Bare minimum, it should be at 30. They prefer bare minimum to be at 80. So she is putting the request out to the doctor to do infusions. The doctor's not in the clinic today, so don't know if this will be looked at until Monday, because there's no doctor in the clinic on Fridays or on the weekend. The clinic's closed those 3 days. So it might not be looked at by the doctor until Monday. And with any luck at all, on Monday, they can get things in the works, and by Wednesday, have me in the chair for an infusion. So hopefully, fingers crossed that the chairs aren't fully booked with other patients and can get a spot in there as soon as possible after the doctor reviews this. So yeah, I did tell her that if something comes up and I can come in, I need an hour's notice, minimally. But like for me to brush my teeth or whatever and have that few minutes to freshen up before I leave, and then drive the full half an hour from my place to the hospital, I need an hour. So I think that's not too big of a request to ask, but I guess if somebody just phoned 10 minutes before their appointment and said they couldn't come in, it wouldn't work for my situation to get there on time. But I let them know that I can be there in an hour if it becomes available. I'm really wanting to make sure to get this done so that I can keep my body healthy enough to keep going with all these chemo infusions. If they deem me not healthy enough, they will delay it. And there's a reason why they have this protocol with my situation, is because they figure it's the most effective way to get rid of all the cancer and prevent recurrence. So I prefer not to have any delays or any changes needed so that I can have the best outcome. So yeah, that's my, I guess, mid-morning update. I was laying here relaxing, listening to a YouTube video, and I was kind of getting ready to doze when she called, and that kind of woke me up for a bit. But now I'm gonna lay back in my comfy recliner that I have here that is definitely getting formed for my body shape. I've been using it a lot the last 6 months probably. But yeah, I'm gonna go nap now. All right, bye. Thanks for checking back or continuing to watch the video, I guess it is. All right, bye. So it has been a bit of a crazy day today. All I've wanted to do was take a nap. I was awake at 3:30 this morning, and it was just, I don't know, I think the steroids that I'm on right now from the chemo, I think the steroids are supposed to help with the nausea. I think made it so that I couldn't sleep very good. I don't have very good energy because my iron is all not good, but I still can't sleep even though I feel like a zombie. So this morning I got all my breakfast and everything and all that done, and then I was going to lay down for sleep and laid there for a bit and was relaxed, and the phone rang and it was the clinic talking to me about my iron. So got that all dealt with. So I laid back and was relaxing again, and then I got another call from the blood services, and they've been calling every 2 weeks or something like that, very often anyways. So I didn't really want to do it, but I did end up asking them to take me off the call list. I can't donate right now, and I haven't really even looked to see if I ever will be able to donate again, so there's no need for them to be taking their time to call me. And it's just, right now with what I'm going through, every call that comes in, if I recognize the phone number or not, I do answer it. Well, I shouldn't say that. Every number that I don't recognize, I do answer. Sometimes if it is a number that I recognize and I'm just not up to taking the call, I will just let it go to voicemail and call them back. But the ones that I don't recognize, it could have to do with my medical situation, so I answer it. So yeah, I finished the call with Blood Service Canada, and yeah. Plus, in my situation, I don't know if I'll ever be able to again. I haven't really looked that up, but I definitely can't right now. So I asked them to just take me off the calling list, and I do have the app, so, and I know how to set it all up, so, and I won't forget. Anyways, got that done, and then I was laying down trying to go to sleep again, and all of a sudden we got a lightning and thunderstorm, and of course the dog was going absolutely berserk during that, so no sleeping through that. So got through all that and the dog settled down, so I laid back and tried to go to sleep again, and by this time it's, I don't know, 2 o'clock, 2:30, and I still hadn't really got a nap in it all. At most maybe 1 minute, but I doubt even that. And all of a sudden the dog's going berserk again. Some random dog was wandering around in our yard, so she barked at that silly dog for a good 5-10 minutes, and the dog was just wandering around smelling everything, I'm sure marking stuff, and pretty soon or after a while I should say, she quit the barking and was just kind of doing a low woof, which is a little easier to tolerate than prancing and running all over the house barking like a crazy dog. So, when was that? Oh, I might be getting mixed up. I think I fell asleep after the rainstorm. and woke up to our dog barking at the dog in the yard. So that was kind of a startle. And I did get about 30, maybe 40 minutes of actual sleep, and it was a good sleep. I did feel better after, although I'm still tired. Hasn't been a bad day. I took my blood pressure again, and it's in a decent range. Headache has subsided, which is good. I don't know, not really much more to report. I start my injections tomorrow, so I'm trying to be prepared for that, because on the first cycle I was really affected by it, so I will assume that will happen again and just prepare for it. Yeah, other than that, I'm just relaxing. My coffee tastes good today. I would be delighted if it forever tasted good through all of this, but there's going to be days there, I'm sure, that it's not, so I just make sure to take note and notice when it is good. I only had 2 today, but I still enjoyed them. And I don't know if you can hear that little jingle. We turned back on our driveway monitors. It's just nice to know when people come in the driveway, and the darn caterpillars are crawling over the sensor, and it's been ringing every few minutes, so I'm going to go and unplug it again, I think. As much as I like to have it on. Oh, yeah, I didn't have the sensor on yesterday, I guess it was, and Hydro, I can't remember if I told this story. Hydro had called and said that they were coming over. I have a note in my file with them to call before they come so I could bring the dog in the house. And I put the dog out to do her business before this new guy come, and I guess I lost track of time. I was getting changed or whatever, and Poncho was outside, and all of a sudden I could hear her barking. So there I am, half dressed, literally, just in my unmentionables. And I'm like, oh shoot, what should I do? So I run to a door where the guy can't see me, and I try and call to the dog, but she's not going to listen because she's busy barking at him. And he's like, oh, it's okay. So I hurried back into the bedroom to get dressed and went out there and dealt with it. But man, the timing on that, so it just so weird how sometimes the timing is just so ironic. Of all the minutes in the day, he had to show up while I was in the middle of getting changed. Yeah. Anyways, I don't think he saw anything, but I was still super embarrassed. Oh well, I guess it's just another one of those moments given to me to just learn to get over stuff. Yeah. Anyways, it was terrible. Anyway, yeah. I am embarrassed about it. I'm just gonna hang out for the next hour or two. My nausea's been good today. I took the bucket and put it beside the bed last night, and I felt so good today. I didn't even bring it out by my chair. Oh, I forgot to turn my notifications off. Darn. Sorry about that. But I can't remember if it was the first 3 days after the chemo infusion or if it was during injections that I really wanted to have my bucket nearby, but it's still handy. I haven't had to use it, and I hope I never do. But my nurse that I've had this cycle has mentioned a number of times that she doesn't give out gold stars to people that tough it out. So if I have any kind of bad side effects, get a hold of them, or call the health line, and if it gets that bad I can go to ER and get help. But don't tough it out. There's lots of things they can do to help with that, so I am keeping that in the back of my mind. It's a tough enough journey as it is. We don't need to allow it to get that miserable. Alright, I am going to keep this one a little bit shorter. I find to get real... Oh, there's that silly buzzer again. Yeah, I gotta go unplug it. Drive me insane. I get chatting about different stuff, and I feel like I can just share so much on here. Yeah, all right, well, thanks for checking in, everybody, and hope I have a good night, and I hope you all have a good night, and I'll try and check back in tomorrow. Bye.